name's Elizabeth Ciordia, and we are currently in week 7 of Biology 230 Anatomy and Physiology 1, and it's August 17, 2024. I do have a little note card with the areas that we need to make sure to address. And then I have my dissected brain here. I did already remove the dura mater. So I'm going to start with a superior view. These would be the frontal lobes here, parietal lobes here, occipital lobes right down here. And then these little areas here where it looks like it's like bulging kind of, that would be the gyri. And all these little like lines or indentations, those are the sulci or sulci. They look like little valleys. And then this part in the middle here, that's the longitudinal fissure, and it separates the right and left hemisphere of the brain. And then we have the cerebellum right here. And then we'll go ahead and do like a lateral view. This here would be the temporal lobe. And then this part here, let me move my finger here, is the pons. The medulla oblongata, the spinal cord, and the cerebellum is up here, this one here. And then now we'll do a sagittal view. Okay, so this part here would be the corpus callosum. Then we have the thalamus here. Hypothalamus is over here. The pineal gland, the midbrain, the pons, and the cerebellum. And then now we will do the inferior view. This would be the olfactory bulbs right up here, the optic nerve, the optic chiasm, and then the frontal lobes would be here, temporal lobes here, the pons would be this area right here where it looks like kind of like it's bulging out, then the medulla oblongata here, spinal cord here, and then the cerebellum, you can kind of see it here on the sides. And the disease that I chose to talk about today is Parkinson's disease. It's a progressive disorder that affects the nervous system and the parts of the body controlled by the nerves. Some of the structural and physiological changes that occur with this disease is that there is a degeneration of cells, of nerve cells in the substantia nigra of the brain. That controls movement. The nerve cells die or become impaired and lose the ability to produce dopamine. And dopamine is very important because it's a neurotransmitter that helps coordinate the nerve and muscle cells that are involved with movement. So if the levels become too low for dopamine, then the balance becomes disrupted, and that's when you start to see problems with movement or symptoms. In patients with this disease, they also see a decreased white matter volume in certain regions of the brain, cortical thinning in the frontal and posterior cortices. Also, they see atrophy in the left pallidum and left putamen. It can cause muscle rigidity, cognitive decline, resting tremors, involuntary shaking that can get severe. Gait is impaired. It's common to see a lot of patients will lean forward with this disorder. There's impaired dexterity. Sometimes these patients look like they don't have expressions on their face. It's like expressionless. And then just an overall slowness of their movements. Thank you.